Dr. Nikki here, back to answer all your questions about pee, poop, and sex. Today's question comes from Karen, and she writes, Dear Dr. Nikki, I had a baby 6 months ago and had a 2nd-degree tear. Ever since, I have had excruciating pain in my butt, making bowel movements dreadful. At my last checkup with the OB, she said that everything is well healed vaginally, but I have an anal fissure, and there's nothing I can really do about it except wait for it to heal. Is that true? Is there anything I can do to speed this up? It's really creating a lot of pain and anxiety. Please help. Graciously, Karen. Oh, Karen, I feel for you. It is probably the worst thing to have an anal fissure. It's ironic how something so tiny can create so much pain. So let me see if I can help. First, let me try and explain what an anal fissure is. In your pelvis, the back organ is called the rectum. The rectum is basically the poop holder until it's time for the poop to come out. Right at the bottom of the rectum is the external anal sphincter, which is a muscle, part of the pelvic floor group. And just past that is the anus. And an anal fissure is like a little paper cut or a little crack right in that anal opening. And it is dreadful, right? It is all about location. You can have the tiniest little thing in the right spot and it creates havoc. An anal fissure is one of those. So let me see if I can help. First and foremost, you want to protect that area. It sucks because every time you have a bowel movement, the poop comes out and scrapes that area and reopens it. So it's like picking a scab all the time, once a day, twice a day, every time you have a bowel movement. So protecting that area is essential. I have found that the best cream is called calmoseptine. It is this pink paste that you can buy at any pharmaceutical store or online. And it's like really thick diaper paste, okay? Really thick ointment. And this one is pink and it has a little bit of menthol in it, which feels really soothing to that area. And that helps mask the pain that could be perpetuating spasms, which could be restricting the blood flow and preventing it from healing. It could be not healing for a couple of reasons. One is the muscle is really tight around it, trying to protect that area as it's healing. Well, a tight muscle doesn't really allow for blood to flow. So in addition to protecting that area, think about relaxing those muscles. Relax your butthole, basically. A lot of us have holding patterns in our pelvic floor for a variety of reasons. Primarily, I think, is that we've been told to hold that area tight all the time. Suck our bellies in, keep our pennies in. It's just this thing that we've been taught as women in this society. So set an alarm on your phone to go off every hour. And when that alarm goes off, pay attention to any tension or holding patterns you might have in that area. Relax your belly, relax your vagina, relax your butthole, and relax your jaw. There is more and more evidence coming out that shows a correlation between TMJ dysfunction and pelvic pain. So when that alarm goes off every hour, relax your belly, your butthole, and your jaw. The more we can relax that area, the more easily blood will flow into that area and help heal that fissure. It's just like any other cut or scab in the body. Another thing that you can consider is taking a magnesium supplement. Talk to your doctor first, I'm not a medical doctor, and make sure it is safe for you to take magnesium. But magnesium is excellent for calming the nervous system and it's a natural stool softener. So as you know, if the stool is a little harder, that's going to reopen that fissure much more easily than a soft bowel movement. So see if you can take magnesium, protect that area with some calmoseptine cream, and every hour relax that body, relax that part of your body, including your jaw. One last thing that you can consider is raising your feet during a bowel movement. There is a newer thing now called the squatty potty. Google it. And it's basically a 6 or 8 inch step that you can leave in the bathroom and put your feet on top of it while you poop. And it positions the pelvis in a backward, like a squat rotation, and that helps open up that anus and rectum more naturally, allowing the poop to come out without straining. Any kind of unnecessary pressure in there is also gonna compromise that fissure area. So look into a squatty potty, or if you have a step stool in the kitchen or garage, grab it, leave it in the bathroom, and every time it's time for a bowel movement, open it up, put your feet on top, relax, relax your jaw, relax your belly, and try not to push too hard, and just let the poop come out as it will. And be patient. So in summary, calmoseptine cream, create a barrier that protects that cut. Number 2, relax. Relax, especially the muscles around your butthole. Number 3, see if you qualify for a magnesium supplement. And 4, recreate the squat on the toilet to help open up that anus naturally, allowing for a more easy bowel movement. I hope that helps Karen and anybody else who's suffering with an anal fissure. If you have any other questions about pee, poop, or sex, email me, Nikki at theorganicpt.com. That's NIKKI at theorganicpt.com, or visit my website, drnickycohen.com. Hope you have a great day. Bye.